My name is Dr. Brianna Evans, and I have two doctorate degrees, one in psychology and one in sociology. This is the case study of Lauren and Noel D. Camillus and their suffering from separation anxiety. Separation anxiety is a disorder that describes an individual's feelings of persistent and excessive anxiety related to current or oncoming separation from an attachment figure. An individual develops extreme anxiety as a result of the separation. The diagnostic criteria is a psychological evaluation, including a structured interview that involves discussing thoughts and feelings as well as observing behavior. Separation anxiety disorder may occur along with other mental health problems. The 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, has recently introduced important classification changes, including the introduction of separation anxiety disorder into the section of the anxiety disorders. The symptoms include high levels of distress and anxiety when separated from home or the attachment figure, constant worry over losing the attachment figure or having harm done to it, persistent worry about experiencing an event that would cause separation from the attachment figure, difficulty or refusal to go out of fear of separation, fear of being alone or without the attachment figure, reluctance of sleeping away from home or going to sleep without being near attachment figure, nightmares about separation. According to the Diagnostic and Statistical Manual of Mental Disorders, separation anxiety disorders is seen in 4% of children and 1.6% of adolescents, making it the most prevalent anxiety disorder among children under the age of 12. It has been shown that the 1/3 of subjects that were classified as childhood cases might persist into adulthood. The causes would be the changes in environment, stress, insecure attachment. The present twin study, based on a retrospective approach, revealed a substantial genetic contribution to separation anxiety in females but not in males, with unique environmental influences being important in both gender groups.
Hi, my name is Dr. Jen Fries, and I'm a psychiatrist specialized in behavioral therapy. To resolve the feelings of separation anxiety, an individual must develop a sense of safety and trust in others. Cognitive behavioral therapy is an effective form of therapy for separation anxiety. During therapy, individuals learn how to handle and manage their fears about separation. Exposure therapy is also commonly used. Systematic desensitization therapy works by carefully exposing the patient to separation in small, controlled sessions to help reduce their anxiety over time. Doctors also use relaxation training and teach individuals coping strategies. Separation anxiety commonly occurs in conjunction with other mental health disorders such as specific phobias, post-traumatic stress disorder, generalized anxiety disorder, obsessive-compulsive disorder, personality disorders, or depressive disorders. Behavioral therapy had its beginnings in the early 1900s and became established as a psychological approach in the 1950s and 60s. At this time, it received much resistance from the current school of thought, Freud's psychoanalysis. Important behaviorists are Pavlov, Watson, and Skinner. Behavioral therapy applies learning principles to the elimination of unwanted behaviors and replaces them with more adaptive behaviors. Systematic desensitization is a type of exposure therapy that associates a pleasant, relaxed state with gradually increasing anxiety-provoking stimuli. After learning and mastering relaxation techniques, the patient will construct an anxiety hierarchy to break down their most feared situations into more manageable components. Once a patient has created their hierarchies, they can begin at the easiest level and gradually work toward the most anxiety-provoking situation. If going to the next stage induces anxiety, the patient can return to a lesser stage in order to build on their relaxation training.
So our mom wanted us to come just because she's nervous. We are going to different colleges. I think we'll adjust fine, but
So, how do you guys feel when you're apart?
I get a little jittery. It's kind of hard for me to concentrate. I kind of just think about when we're going to be together again. Sometimes I'll cry.
Do you feel worried about not being with each other?
Yeah, because it's like I just don't know if she's okay. I like to be in the know. Yeah, I don't know what I'd do without her, and I just don't want to be apart for too long and have something bad happen.
How would you guys feel about some exposure therapy?
Exposing us to what?
So we'll start by making an anxiety hierarchy of the things that you fear the least, and then all the way up to what you fear the most. And we'll slowly work up by starting at the least feared all the way up to the top, which is the most anxiety causing.
Okay, I think I can do it.
So, what would be the least anxiety provoking thing you guys could think of?
I mean, maybe we could wear different shirts.
Okay.
Yeah, we could change.
So do you guys want to start with that then?
Yeah, sure.
Okay, so how about you guys go change shirts? Hi, welcome back.
Thank you.
So, on a scale of 1 to 5, how anxiety provoking was that for you guys?
I mean, it did make me have a small panic attack. It's not as big as some of them have been in the past though, so I feel like it's a good stepping stone.
Okay, wait, so did you guys just switch shirts?
Yeah, we're not supposed to.
No, it's fine.
It did make me feel some anxiety.
Okay, so do you normally have panic attacks?
A little bit, especially when I think about us going off to different colleges. It's a little hard.
Okay, how about you?
Yeah, I usually either have panic attacks or I cry for prolonged periods of time. When I think about it, I just always feel anxious, but then it gets worse when she's not there.
Okay,
There's been some nightmares thrown in there.
Oh, okay. How often do you think you would have a nightmare?
Like every night?
Yeah, every
Since
night.
we got accepted to different schools. Yeah. What do we do next? I just feel lost.
Okay, so what would be the next thing that you guys could do apart from each other?
I mean, maybe you could try going somewhere without me, but just up the street.
Okay.
I mean, if you're comfortable with
I
that.
haven't done that ever.
Well, maybe it's time to try.
Would you go with me?
Of course I would. Do you think that might be something you could do?
Yeah, I'm just getting a little nervous thinking about it.
That's okay. Just take a deep breath. She's gonna be here and she'll be fine.
You can FaceTime.
So this is the final step with Noelle. How are you feeling?
It's really hard. We're doing it.
You're doing it. Yeah, great job.
Thanks, Dr. Freeze. Now we can do anything apart. I'm ready to go to JMU. I'll miss you though.